like to kindly ask if you could please hold your questions, if you have any, until the end, so that I can make sure to cover all of the information in the presentation. Okay, next slide. So first, I hope you don't mind if we get started by me asking you some questions now. So let's see how much you already know about HRSA and its Health Center program. Here are a few polling questions that I hope you don't mind answering. And just take a few minutes to see what you already know.
And Commander, can you hear me?
Yes, sir.
All right, I've opened up the first polling question. We have to do them one at a time. So the first one is, have you heard of HRSA? Yes or no are your two options. So we've opened that up for our audience to respond to, and we'll leave it open for 15, 20 seconds or so.
Okay, and will I see them responding or no?
I will share those with you once we close the poll. Yes, sir.
Gotcha. Thank you.
You're welcome.
And so just feel free to move on with the poll questions to the next one as you see fit.
Okay. We've only got one person outstanding here, so I'm going to go ahead and begin to close the poll down. It does take a moment for the poll to calculate sometimes. But just as we're waiting, I will say that of our responses, 16 said no, they've not heard of HRSA, and 7 have said yes.
Okay, thank you. I got it.
Save us a little time there as we're...
Yep, no, I appreciate it. That's great.
No problem, sir. We'll go to the second polling question, and I'm opening that now. And we still have a small handful of folks who have not clicked that submit button yet, so we'll go ahead and wait for them to finish up. There we go. We'll go ahead and close this poll question, and you can see the results on your screen. It was pretty, 2 said yes, 21 said no.
Gotcha, thank you.
All right, and the third one, I believe, is an open text question, so we'll go ahead and open that. And this will enable you, if you answer this question, to type in a short open text response for this polling question. And I don't believe on this one I'll be able to share the individual responses with you, Commander, just as a...
Yeah, that's fine. I was just curious.
Okay. We are archiving these answers, though, for future reference.
Perfect.
All right. We are almost going to wrap this one up, and we've got a few folks that are finishing their open text entry. We've got about 20 seconds left to complete that. Hopefully you're a fast typer. We're not trying to rush you, but the poll will close in about 10 seconds. And of course, at any time, if anybody wants to share their thoughts or their responses, if a poll closes in the chat window, please feel free to do that. All right. Okay, so we'll move along to our fourth polling question. If you're following along with the bullet points on the screen, is did you know that patients can receive mental health and substance use services at HRSA Health Centers? That is the question. Yes or no are your two answer options. Now that we're into our couple of questions in, the responses are coming in much faster, so thank you everybody for participating. All right, we'll give this one 2 or 3 more seconds, but it looks like everybody is done responding, so we will close this one up. We had one more person sneak in at the end there. So as we're waiting for that individual to submit, we'll just give you a quick synopsis that the yeses were 3 and the noes were 24 on this one.
Mm-hmm.
And all right. And we will go ahead and move to our 5th, and I believe this is the final polling question we have in the initial here. Have you ever obtained any type of primary care or behavioral health services at a HRSA Health Center? And this one also is a yes or no question. All right, it looks like most folks are done here, but we'll give this one 3 or 4 more seconds to see if there's any last-minute responses. And we did have one just come in there at the end. All right, we'll go ahead and we'll close this one as well. And this one was actually all responses were no. 27 out of 27 were no, they've not received services.
Okay. Okay. You're turning it back over to me now?
Yes, if you want to go ahead and continue, I can advance slides for you.
Just 1 second. Yeah. Okay. Wow. So, wow, folks have really never heard of us. Oh my gosh. Actually, you know, I'm not that surprised. A lot of folks have not heard about our great program. It's kind of like one of the best kept secrets in federal government. But anyway, we're out there, and it's my job to educate you about what we have to offer and get you and your constituents into our health centers. So, yes, please advance the next slide. And thank you so much, everyone, for participating in that little survey, and thanks to the administrators as well. Thank you. Okay, so just to make sure we are all on the same page, these are the topics that I will cover in today's presentation. Hopefully, this is the information that you thought you'd be receiving. So by the end of the presentation, you should be able to explain HRSA's Health Center program, describe the primary care and behavioral health services offered by the Health Center program, and explain how to access the Health Center program's services. So next slide, please. You are already familiar with the Centers for Medicare and Medicaid Services, I'm sure. You probably also know that CMS is an agency under HHS, or the Department of Health and Human Services. During the polling questions, we learned that a few of you, not all certainly, had heard of HRSA. And well, for those of you less familiar with HRSA, it stands for the Health Resources and Services Administration. You should also know that we are a sister agency of CMS, and we both fall under the auspices of the Department of Health and Human Services, and HRSA is on the same row of the organizational chart as CMS. HRSA's headquarters is located in Rockville, Maryland, so not too far down the road from the headquarters for CMS. Next slide. And to familiarize you even more with HRSA, here's our organization chart. During the polling questions, we learned that even fewer of you knew about the Health Center program than you did HRSA. And on the organization chart, the Health Center program's formal name is the Bureau of Primary Health Care, or BIPIC, and you'll hear me refer to it as such. And that, of course, doesn't sound so appealing as the Health Center program, but rest assured, it's essentially the same thing. Health Center program is a lot easier to roll off the tongue. And HRSA has a lot of programs that many people probably have never heard of. And again, here's where you'll find BIPIC on HRSA's organization chart, or the Bureau of Primary Health Care, or the Health Center program. Okay, next slide, please. So what's the name again? Just to quickly recap the acronyms so we can be sure that they stick with you throughout the presentation. HRSA is the Health Resources and Services Administration. BIPIC, or the Bureau of Primary Health Care, is a bureau within the within HRSA. And the Health Center program is essentially the same thing as the Bureau of Primary Health Care, a less formal name for it, the Health Center program. And FQHC, or Federally Qualified Health Centers. So I suspect that many of you thought you were logging on to learn more about FQHCs. And, well, yes, you are. You will get that. But while it is true that health centers in BIPIC's Health Center program are FQHCs, that's not typically how we call ourselves. So FQHC is officially a CMS designation that also encompasses outpatient health programs or facilities operated by a tribe or tribal organization or by an urban Indian organization. And many of those programs receive funding from the Indian Health Service, not from HRSA. And however, the Indian Health Service is yet another sister agency to both HRSA and CMS under the Department of Health and Human Services. So I hope that everybody is still with me and that wasn't even more confusing, but I thought it'd be helpful just to clarify what those acronyms are, at the very beginning of the presentation. So thank you. Next slide, please. So this is what HRSA does. We support more than 90 programs that provide health care to people who are geographically isolated and economically or medically challenged. We do most of our work through grants and cooperative agreements that go to more than 3,000 awardees nationwide. Every year, our programs serve tens of millions of people, including people living with HIV and AIDS, pregnant women, among others, who are otherwise unable to access quality health care. I'll pause here just to let you absorb that information. Okay, next slide, please. And this is how we spread our money around among all of our different programs. And so let's take a look at what we have here. You'll see at the top, primary health care. You'll recall that that's the Bureau of Primary Health Care, or, like I said, the Health Center program. You also see here funding for the many other programs at HRSA, such as HIV/AIDS. Maybe you all have heard of the Ryan White HIV Care Program or the AIDS Drug Assistance Program run out of many of the states, or ADAP. Our HIV/AIDS Bureau helps to administer those programs. Next slide, please. Now let's turn our attention to focus exclusively on HRSA's Health Center program. Here's our mission. It's very, very important to us, so I'll go ahead and read it to you. To improve the health of the nation's underserved communities and vulnerable populations by assuring access to comprehensive, culturally competent, quality primary health care services. Simply put, it really is the reason that we show up for work each day. Next slide, please. So let's now take a quick look at a video that will shed even more light on our program. So if you can roll that.
All right, I'm going to go ahead and play this video. It should play through your computer speakers or your headphones, but just ensure that you're on mute, please, as you listen to this. Thank you.
It was a novel idea back in 1965. Two small health clinics committed to bringing high-quality care to people in their communities, regardless of their ability to pay. Healthcare was being debated in the early 1960s. Many policymakers recognized the need to increase access to services were scarce. The movement, which began in the city blocks of South Boston and the countryside of Mississippi, soon caught on. By 1985, 600 health centers were caring for 5 million people a year. Today, HRSA's Health Center program has blossomed into a national primary care network of nearly 1,400 health centers with more than 1,000 sites across America. Organizations helping their neighbors with the building blocks they need to lead healthy, productive lives. And who's at the front of this effort? It's more than 200,000 primary care providers, nurses, dentists, social workers, educators, and other staff care for each year. HRSA-funded health centers are providing essential primary care to 1 in 12 people. 1 in every 9 children living in the U.S. With this primary care, centers offer patients access to oral health, mental health services, and increasingly for access to opioid and other services. Health centers deliver patient-centered, comprehensive, integrated solutions that meet experiencing homelessness, residents of housing, and the nation's veterans. Health centers must meet the highest standards for data quality. The data prove it. Health center patients exceed national average in diabetes and high blood pressure. Since inception more than 50 years ago, health continues to advance quality services to meet patient needs, changing systems. The mission never changes. Health centers provide the highest quality care to their communities. So we salute our nation's health centers. The staff who make up very thank you.
Okay, can you hear me?
Yes, sir.
Okay, great. So yes, we absolutely do salute all of our health centers and also all of our staff for all of this incredible work. And just to be upfront with you, some of the data are a tiny bit old, maybe a year old or so. For example, we know that we now have about 12,000 health center sites in our program, and we'll talk more about those sites in a minute. But I am curious to know, I don't know if people would like to type in the chat pod now, if that's open and available. Just, I'm curious to know if anything stood out to you, if anything resonated with you. I'm guessing that most of the information was new to you, but if anything sort of popped out at you.
Yes, everybody, please use the chat box for any comments.
And I may not have any. I was just curious.
There's a few. Yeah, there's a few coming in right now.
Oh, am I able to see them?
No. Once I know these are community health clinics, places where anyone can get primary care, regardless of insurance status. Somebody has heard of them.
Yeah, I see that now. Yeah. Okay. Oh, cool. Well, great. Thank you. All right, next slide. Okay, so let's now talk some fundamentals. So health centers are community-based and patient-directed organizations that serve populations with limited access to not only primary care services, but also health education, translation, and transportation services that we know help promote access to health care. They provide services regardless of a patient's ability to pay and charge for services on a sliding fee scale. Health centers operate under the direction of patient-majority governing boards, and they are diverse in size, capacity, staff, and population served. So I just want to point out a couple of things that are bolded there on the slide. Regardless of patients' ability to pay, yes, that is absolutely true. Yeah, I was trying to see, yes, in the chat pod there, somebody did, well, they were sort of trying to get at that, regardless of insurance status. Absolutely, folks can walk in and get services regardless of their ability to pay. So we want to ensure in our program, if our health centers agree to become a part of our program, then they have to make sure those services are available to folks regardless of their ability to pay, and on a sliding fee scale. So you won't see every health clinic and every pop-up health center out there that are a part of our program because they can't make that commitment to us. Also, patient majority governing boards. So we believe that the people in the waiting room have the best understanding of what the operations of the health center should be. So certainly the health center has a management team, but they also have governing boards. And the majority folks on those governing boards are the people who are sitting in the waiting room and receiving services from those clinics. So we believe that is a hallmark feature of our program, and we're very proud of that. Next slide, please. So here are some fast facts about our program. As you heard in the video, we started off as 2 health centers, and now we have become a network of more than 1,400 health centers operating 12,000 service delivery sites. I'll pause here to give you a second to absorb that information. Next slide, please. So in 2018, health centers provided care to more than 28 million patients. That's 1 in 12 people in the United States and 1 in 9 children. Health centers serve 1 in 5 people living in rural communities and 1 in 3 people living in poverty. I'll pause here again. Next slide, please. And so here's a visual depiction of where those 12,000 sites are located in your communities. So these sites offer not only primary medical care, but also oral health care services and mental health and substance use disorder services. Next slide, please. Let's take a closer look at a few of those sites, see what they look like, where your constituents and you can receive services. So first up, we have Cabin Creek Health Systems Incorporated in Dawes, West Virginia. You see what the area looked like prior to 2015 and what the site looks like today with our support. Next slide, please. Next is Shackelford County Community Resource Center in Albany, Texas. Again, here are before and after visuals. Next slide. And last but certainly not least, we have Columbia Valley Community Health and Wenatchee. I think I pronounced that right. Sorry if I didn't. Wenatchee, Washington, again before and after. Next slide, please. Okay, so here's the official definition of a site for our program. It's a location where a health center provides services to a defined service area or target population. They must meet all of the following conditions. Encounters are generated and documented in a patient's medical record. Providers exercise independent judgment in the provision of services. Services are provided directly by or on behalf of the health center, whose governing board, again, retains control and authority over the provision of the services at the location. and services are provided on a regularly scheduled basis. Next slide, please. And within that definition of a site, we have a variety of types of sites where your constituents and you can be seen for services, to include mobile van sites. Next slide, please. Let's turn our attention now to talk about some health center program services. Next slide. So there are certain services that health centers are required to provide, and all services are defined at the organization or health center level and not at a site level. So, for example, here, a health center may have 3 sites located in 3 different areas of town. And let's say that the service that the health center makes available is diagnostic radiology. And so it's okay for the health center to provide this service at 2 of its sites and not, necessarily at the 3rd site, or 1 of its sites, but not at the other 2. So a patient who might live nearby the site that does not provide diagnostic radiology, if they are a patient of the health center, can feel free to simply go to another site of the health centers to receive diagnostic radiology. So again, the services are defined at the organization or health center level and not at the site level. So health centers can provide required services either directly via formal written contract or formal written referral arrangement. And we'll talk more about the method of providing services shortly. Next slide, please. So a health center declares to HRSA the services that it will provide on what we call Form 5A, which you will see in a moment. On the previous slide, I described some flexibility for how health centers can provide services. They can do so directly, which is probably the traditional way a patient might receive services, by coming into the health center. This is recorded in column 1 on Form 5A. The health center can provide services through a formal written contract whereby the health center pays for the service. This would appear in column 2 of Form 5A. Or a health center may also refer a patient to another organization by a formal written referral agreement or an MOU. This would be recorded in column 3. So let me just clarify, this. So this third way of providing services, like I said, the health center would not be necessarily paying for the service, but they must have an MOU or formal written agreement in place with another entity that does provide that service. And so maybe both organizations entered into this agreement by some mutual benefit to both of them. But a doctor at the health center can't just find a sticky note and say, okay, here, patient X, please go up the street to such and such organization to receive this particular service, or scribble it on a napkin. No, these need to be formal agreements between 2 organizations whereby a health center's patients can go to another organization and receive care. Next slide, please. So we have 2 basic categories of services on Form 5A. Those are the required services that I talked about, or additional services. We already said the health centers must provide a certain set of required services, but at the health center's discretion, they may also provide some additional services that meet the needs of its population. Health centers can provide these additional services if they want to, but they must keep in mind the following. The health center is essentially saying that they can provide these additional services and not come to HRSA asking for more money. So maybe based on the needs assessment, and all of our health centers are required to do needs assessments periodically. So maybe based on the needs assessment, a health center has found that their population needs a certain service or certain services, and they want to be able to provide that service to their patients, even though it's not required by us. Maybe they have received a grant from the state or a foundation, and they would certainly could be expected to apply and receive applicable reimbursement from Medicare and Medicaid. But again, the health center cannot come to HRSA and ask for more money, but they must ask HRSA permission to include it in what we call our scope of services, or Form 5A. The other important thing to note is the health center can make the service available to anyone who walks through the front door on a sliding fee scale, and if needed, regardless of the patient's ability to pay. So a health center wants to be very careful that when they include additional services in their scope of services, they're not just doing so willy-nilly, that they can afford to do it because they will need to make it available to anyone who walks through the door and needs that service. Next slide, please. So, ladies and gentlemen, allow me to introduce you to Form 5A services provided. So let's take a look at what we have here. So you see there on the left, the shaded blue services. Those are our required services. So health centers must provide those services to their patient population. On the right, the shaded services in blue there, those are additional services. Now, let's say that this particular health center saw fit to make these services available to their patient population, even though it's not required by us. We see also the three mechanisms that a health center can make services available to its patient population. The first column there in white, directly, again, the traditional way that a patient might come into the health center and receive services. Column two, a formal contract that the health center has, and it pays for the service with another, it pays another entity for the service. Or column three, whereby the health center does not pay, but they do have a formal written agreement in place, MOU, MOA, et cetera. And just wanted to point out, for more sort of description of what each of those services includes, there's a link down there called the Form 5A Service Descriptors. You can click on that at your leisure. Also want to point out on the right there in those shaded additional services that are mental health and behavioral substance use services. Next slide, please. And now more specifically about behavioral health services. So I know that the next few slides are a little busy, but if you could just bear with me. So as we believe strongly that behavioral health services are a critical part of primary care, we're very proud of the significant investments that we have made in improving access to and quality of behavioral health services in our health centers. Just this past summer, we awarded more than $200 million to 1,200 health centers across the nation to increase access to high-quality, integrated behavioral health services. In 2018, our health centers provided over 10.8 million mental health clinic visits, and overall, from 2016 to 2018, mental health patients served in our health centers have increased by 26%. And also mental health professional FTEs in our health centers increased 10.5% over the same period. Next slide, please. So we've seen outstanding progress in our health centers with respect to substance use disorder treatment as well. We've seen a 33% increase in patients receiving services, resulting in an increase of 21% clinic visits for substance use disorder services. Medication-assisted treatment is the use of medications in combination with counseling and behavioral therapies to provide a whole patient approach to the treatment of substance use disorders. And we've seen a 46% increase in the number of patients receiving MAT services in our health centers. Next slide, please. And to help facilitate even more outstanding progress in behavioral health integration, we will soon launch a new agency-wide investment. This will be a center of excellence to support expansive training and technical assistance in many of HRSA's programs, not just health centers, on integrated behavioral health services. Next slide, please. So now let's take a look at some resources that we are making available to you. So the first there, of course, is our very own website for the health center program. That's bipic.hrsa.gov. We won't look at that right now. Click on that at your leisure. The second is how you would go about finding a health center near you. It's a very easy website, findahealthcenter.hrsa.gov. And so if we can take a quick demo of how it works, that would be great. So if you can plug in the zip code right where you are, that's where we'd have our, put in our zip code 20857. And yeah, And yes. So that's the zip code of our office building here in Rockville, Maryland. And you see there our health centers that are located near, well, me. In this instance, I believe the red dots are those, yep, thank you, those sites there, and the little stick pin, the black stick pin there is where we are. And so it's really that easy. And so you would click on the plus, where you are, and get more information about any particular one of these sites, their particular website, as well as directions to it, contact information, etc. So it's just that easy, folks. Thank you for doing that. Yeah, we can go back to the presentation. Okay. Yeah, so thank you for doing that. Next slide, please. So in closing, I'd like to, again, give a huge thank you to Commander Todd Johnson at CMS for inviting me, and a huge thank you as well to two outstanding coworkers here at HRSA for helping me put this presentation together. I'm not tech savvy, and you would have been in trouble if I had to do this all by myself. So thank you to those folks. And next slide. Yep. And so thank you, ladies and gentlemen, for your time and attention. Feel free to contact me if you have any follow-up questions or would like for me to maybe come out and speak to your constituents and stakeholders. I'm happy to do that. Just feel free to get in touch with me there. And I believe a copy of this presentation was made available to you, so you have my contact information already there. Yep. Next slide, please. And here's how you can connect with our agency. So HRSA.gov, and I believe that's Facebook and Twitter, and yeah, I don't really do any of that. But anyway, so that's how you can get in touch with our agency. So we'd love to hear from you. And I'd love to hear from you now if you want, if you have any questions. Happy to take them, comments.
Yeah, thank you, Commander Pace. I think we can, Matt, can we unmute the lines and just ask everybody if they're not speaking to keep their phones on mute on their end, but if you have questions at this time, to please ask the Commander.
So this is Steve Preston. I'm Todd Johnson's co-lead. I have a couple of questions for you. So can you tell me if HRSA's programs will, first of all, pay for transportation to locations other than the facility itself? And secondly, are they able to provide, in particular, behavioral mental health services to patients even if they're already under, for example, Medicare?
Okay, yeah, great. Thank you for excuse me for those questions. So I believe the first one was pay for transportation to another facility.
For example, one of the biggest problems that a lot of our patients struggle with is transportation issues trying to get to their dialysis facilities.
Right, so you're saying then to transport the patient from his or her home to the dialysis clinic facility? Is that true?
Yeah, that'd be correct, as well as, many of these patients, maybe Medicaid, not even have that kind of insurance or otherwise, and they still have other problems that, they could get some of their other primary care at one of these facilities.
So as some part of your comment was cut off, I don't know, maybe if people can mute their phones. Anyway, so first of all, the person would need to come in and register to be a patient of the health center. So that's first of all, and then see what services might be available to the patient. And I don't know, every health center is different. Every health center provides a different complement of services. It may be, I don't know, the case that a health center has one of those column 3 MOUs in place for one of the facilities that you're talking about. And if the person is a patient of the health center, that might be indeed, a service that they could get, meaning transported to that center. We have already seen on Form 5A, I believe there, we don't have to go back, but I just wanted to, we have already seen that transportation is a required service that a health center must provide. So again, to its patients, not just anyone in the community. So again, the patient has to be, registered, and the transportation services need to be made available for the patient to access services that the health center has saw fit to have in its scope of services. Now, if the health center does not have that particular service in its scope of service, that wouldn't be something that the patient could access through the health center. So it really just depends on what the health center offers, and where the health center is located. And so the health centers are set up and are required to sort of maximize the use of the third-party payers, out there. So yes, so there would be some the need to have from our standpoint, to have the health centers, whatever insurance options are available that the health center is seeing fit to bill those insurers. And it is absolutely routine for our health centers to get both Medicaid and Medicare reimbursement. As a matter of fact, Medicaid is probably one of the primary means for the health centers to get the money coming into the clinic, and we would expect them to have to be able to bill Medicare as well. And so you should know that our health centers, because they are FQHCs, again, which is a CMS, designation for our type of, health centers, they are able to get reimbursed through at the FQHC rate, which is at a higher rate than your regular community clinic in town that is not a part of our program. So I don't know if that answers your question, but I would be happy to follow up with you if you'd like. But
okay, thank you.
Are there any other questions for Commander? Anybody else? Nobody has any questions. Okay. Matt, if you can go to the next slide. Just kind of then in closing, if there's no more questions, I just want to put
well,
out
I don't know.
the
Should I feel offended? I mean, do your other presenters get questions, or I don't know what that means. No, I'm sorry. Just go ahead.
That's good. No, that's good. Sometimes we have some, sometimes we don't have as many.
Okay.
So it's all right. So we just want to know if your facility or if you know of anybody who has any promising practices. We'd like to hear from you for our for 2020. We'll be working on that schedule and those LAN events. So if you have any best practices you'd like to share, please get a hold of the NCC. This is our last meeting for 2019, and the next one will be, I believe we're keeping the same schedule, will be January 22nd in 2020. Next slide, Matt. And if you stay on the line after this presentation, after we close out, leave your computers up. You should have a evaluation that will pop up that if you please fill out. We'd like to hear your feedback and get that feedback from you. And then if you need CEUs after the completion of the SurveyMonkey, and then after you hit submit, then the information, the screen should pop up like this to give you the opportunity to get your CEU credits. And next slide. And again, follow us on social media for Facebook, Twitter, or YouTube. Next slide. And again, if there's no more questions at this time, I'm just going to thank all of you who've taken time out of your day to join us, and thank you, Commander Pace, for taking time out of your busy schedule to do this presentation. We really appreciate this information, and yes, these materials will be sent out to everybody, all the PowerPoint, within 10 business days. So be looking forward to getting that information in your email. So if there's no more questions or no further comments, we give you back about 10 minutes of your day. Everybody, then thank you again. This concludes our LAN for the day, and we will talk again next year. Enjoy the rest of your day, and thank you, everybody, for attending.
Thank you.
Thank you. Bye-bye.